All right, in this video, we are going to talk about how to generate topics, what kinds of topics, and how to create a volume of topics that are easy for you to create content from. And so this is a really great topic because I think a lot of doctors think, well, if I do an hour or 2 hours of video, how much more can I actually say on video? You know, I don't know what I would even say. And so the first thing that I would say is when starting with video, you want to start with videos that are most comfortable to you. And for doctors, it's a simple one. You answer questions all day long. So starting with answering questions and putting the questions like, what is a common question that somebody would ask me about these topics? And then just listing the topics out, right? So that's an easy one. And so if you're talking about dry eye, what are, the common questions that a parent might ask you, common questions that somebody with diabetic retinopathy might ask you, a question that a potential referral source might ask you, a question that somebody might ask you about contact lenses. Can I sleep with contact lenses? What contact lenses are best? Well, and by doing that, you're really putting yourself in the driver's seat in the sense that you're used to doing that all day. It doesn't require you to go and sit and write long notes about what to say or how to say it because you're doing that already. You're doing that every single day. And that's a great starting point to creating a video. And as I always say, the first 50 videos are the hardest. So once you've created that volume and you get into it, then you can start experimenting with other types of videos. And so what I would say is go specialty by specialty or topic by topic. Take eye emergencies. Say, what are some of the questions somebody's going to have on conjunctivitis? What are people going to ask about chemical spills? What are people going to ask about a cut or scratch in the eye? What are people going to ask about bruised eye? There's so many different kind of topics that you could talk about. And by breaking it down into each one, then it's going to help you kind of come up with a longer list. Another thing that you could do is kind of take a topic and then say, what are questions somebody might have about symptoms? What are questions somebody might have about treatment? What are questions somebody might have about diagnosis? What are questions somebody might have about how you do it in the office or what the process looks like? Or how common this is, or comparing different treatment options or medications that are available. So that's a great way of kind of breaking it down. And then if you take, let's just say for an example, you talk about myopia, just picked one off right in kids. And so you might want to break it down by what does it look like in your office is a whole kind of different thing. How it would work. What are the treatment options that you provide? Do you do atropine? Do you do MiSight? Do you do Ortho-K at the office? You might want to talk about kind of the symptoms, or in this case, it's not so much the symptoms, but kind of identifying who needs myopia management or when to slow it down, and then you could talk about statistics is always a good one. Research is another kind of topic that I always recommend talking about. So what is the latest research about maybe the efficacy of different treatment options, but also about the statistics about the increase of as the nearsightedness increases and the increase of eye disease or the general increase of incidence of nearsightedness and why it's a health risk in general. So just that was kind of just off the top of my head, breaking down kind of one topic and giving you some ideas. I believe that you could probably spend easily an hour without even sweating on a specific topic like myopia management or like really any topic. There's enough to go into and go in depth. Then another way that you can generate content is to symptom by symptom. And that's a little bit trickier, right? But like, for example, if you take dry eye and you're saying, you have crusty eyes, you have watery eyes, you have teary, you have dryness, you have scratchy, feeling like something stuck in your eyes. You might have red eyes or puffy eyes or pain or blurriness. And all of these things are going to be, each one can be a video. And the one way to look at it when you're generating these topics is that as people are scrolling up their social media feed, they are going to skip your video most of the time until one day your video is talking about the exact thing that they experience and they're going to stop and watch it. But they've seen you a bunch of times already. And that's kind of the key, right? Is that creating this volume of content where you're putting out topics on a wider range really kind of lets you kind of be having a conversation with the patient on something that's important to them. And that's where that value creation and brand creation starts coming along. And once you get to, once you've finished kind of those two, then I would look at maybe going into specific kind of targets. So for example, let's say you're a sports vision practice, and this is one I've talked about a lot, is you don't want to do a video that's about sports vision. You want to do a video that is about baseball. And you don't want to do one video about baseball, but you really want to explain to the patient how your service can help them in the thing that they care about, which is baseball. And so you're talking about the visual skills needed for different positions. You're talking about statistics or research that was done to show that sports vision training improved baseball performance and these kinds of things. You might share a story about a baseball player, someone famous or someone not, someone you've seen perhaps, and how sports vision has improved their life, or go in more depth and share some research that was done, such as, the University of Cincinnati and the success they had with sports training and baseball performance. So that's just one sport, but now you have all these different sports that you can go through. And the same would be for talking about contact lenses and thinking about the different use cases or the different kind of categories of people. You have people who see contact lenses as an option to replace reading glasses, and that's their own topic, and you would like to create some content on that. Or maybe it's somebody who has difficulty with contact lenses in the past, or dryness, or somebody who would like contact lenses kind of here and there option, or somebody who didn't have success with contact lenses in the past, and therefore now you're kind of talking to them about the newer updated options that are available and innovations in contact lenses. So there are a lot of topics that you could talk about. Then and this is a big one, and I think is mostly overlooked, is all of the topics that you would like to say to the patient in general, right? So for example, what to expect after in our dry eye program, or what to expect in vision therapy, or and kind of going in depth and giving the whole spiel, the whole story to the patient, or to their family members. And this is actually really important in my opinion, because a lot of times, let's say you're talking about vision therapy and the mom comes in, or the dad comes in, or the grandparent comes in with a kid, but they're not the only person who needs to make a decision on whether to start the treatment. And they need to go back and now tell whoever it is they're telling back home something that is impossible for them to do effectively, because let's face it, they barely understood what you were talking about in the office, let alone being able to coherently explain that to somebody else and get them to see why this is so important. So creating a video playlist or a longer video about here's what to expect. And this is also something that a lot of ophthalmologists get, what to expect from cataract surgery, or, what to expect after cataract surgery, or understanding the different lens options. That can be something that's really, it saves time in the office, but more importantly, allows you to have a longer form conversation with a patient. And that's important for the quality of care. And so a lot of times we kind of don't see it that way, but this is, I think, most evident in low vision, where it's hard, or the saying goes, it's hard to make money in low vision. And it isn't true, but it is hard if you don't do it correctly, because you have so much information that you need to talk with the patient about, whether it's the fact that the patients typically are older and it takes a little bit longer to explain things to them for them to understand it, whether the fact that nobody really took time to explain to them just what's going on in their life and the amount of changes, or the huge variation of options that are available to help them, from improvements in lighting and ADL kind of tips and tricks to stuff to the fact that their low vision devices are typically going to be activity specific, and so you have to talk about near and far and mid distance and portable and all these kinds of things, digital versus non-digital, and handheld versus non-handheld. So you have a lot to cover, and so part of creating the video content can also be, if I had all the time in the world for this type of patient, what would I say to them? And then can I create a series of videos that I can then say, instead of having to sacrifice on what I want to say to the patient, I'm actually going to send them or have a print out a card with a QR code and maybe a short link that takes them to a playlist that I've created either on my site or on YouTube that's going to basically go through everything that I would want to say about that topic. So that's really valuable in my opinion. As you go further into the topic creation, don't forget to talk about yourself and the practice. The number one page in that most people will visit on an eye doctor's office website, an eye doctor's website, is going to be their bio, the doctor bio page, or the staff or the team page. And that's because they want to see who the doctor is. And that's something that I think a lot of people misunderstand, is that the doctor is the brand. It isn't the company name, and it is the doctor because that's who's doing your treatment, not the brand name. And so a lot of times, if you can humanize yourself and tell stories and why you got into it, why you're passionate, that's really important. And I would highly recommend, even if you're not going to get into the daily video side of things, to consider doing a series of videos or a longer video about yourself, so that when somebody does come to your bio, they get a better sense of who you are, your passion for what you do, your expertise, and all of that. Now, moving on to other topics that you could definitely talk about. So then there's myths, and I like this one. Are carrots the only good thing for my eye? Is driving in the car bad for my eyesight? Is reading in the dark gonna make me go blind? I think it was like, I heard this one, which is like, I'm not going to say it because it's probably not a good one. All right, never mind. There are all these different kinds of myths that you can cover and debunk. And so those are great. And if you don't know the myths yourself, so tools like ChatGPT or, some of these AI tools out there, they can give you a lot of myths on, just, create a list of myths that are common in eye care. And then you can just talk about them. Then another thing that you can do is comparisons. So for example, understanding the different treatment options for dry eye, LipiFlow versus tear care versus heat masks versus punctal plugs versus IPL versus RF, right? It's all mumbo jumbo to patients in general, and even to most educated patients or people like me, there's a lot to consider and understand. And I found that some of the best content in terms of performance has been comparative style content, understanding the different options that a patient has. In terms of other topics, so just as a general rule, once you have a list of topics and you feel like you're good, take a tool like ChatGPT or Claude and plug in your topics, and then ask them for ones that are similar, and try to see if you can come up with additional ones that you would like.